Can you briefly introduce yourself, your organization, and what is your role at your organization?
Yeah, I'm Adam Snook. I'm a professor of pharmacology, physiology, and cancer biology at Thomas Jefferson University. And I also co-lead one of the Cancer Center programs there on immune cell regulation and targeting.
Okay. For your presentation is about the universal cell therapy for the solid tumor. What are you trying achieving for your study or research?
So currently, all of the CAR T-cell therapies that are on the market are approved for cancers that have relatively low numbers of patients and are manufactured essentially one patient at a time. What we're trying to do is create a product that can be manufactured for many, many patients at once and applied to many different kinds of cancers at the same time. So a universal cell therapy product that's off the shelf and applied kind of universally across solid tumors.
Sounds interesting. And what's the biggest challenge during your research for the cell gene therapy?
Yeah, I would say that one of the biggest challenges is actually counterintuitive, and it's around all the innovation, right? So there are many, many new technologies that are emerging all the time around, for example, different strategies for gene editing or different strategies for gene delivery. And so identifying the right ones that make sense for us and finding the right technologies to put together for our needs is actually one of the big challenges. We can do anything, but we can't do everything all at once.
Right.
So overcoming that is one of them.
Okay. And for like you mentioned, there are a lot of innovation you have to work out, and for the innovation, there are some. It relates with the safety. How you balance the innovation and with the safety.
Yeah, so my focus is in cancer immunotherapy, and so for a long time the big failure was efficacy. But now that we have these new and advanced therapies, safety is becoming a bigger and bigger problem. So as we achieve greater efficacy, we also have these greater safety challenges. So for us, it is a constant sort of balance between the two. And so we the strategy that we generally take is that we can work to find effective therapies. If we identify toxicity, we can then understand the mechanisms underlying that toxicity and then work on strategies to mitigate that. So we've already seen that with the FDA-approved CAR T cells where they induce a cytokine release syndrome. The cytokines involved in that were identified, and now antibodies are used to block that. So we can make the therapies safer at the same time that they're advancing forward for efficacy.
That's great. And what is the biggest breakthrough from the past research or speaking of the innovation for the cell therapy, cell and gene therapy?
I would say, I bet a lot of people are giving this answer, but the biggest innovations to me are around the gene editing technologies. So CRISPR was the first one, that kind of emerged, and that has been a complete game changer for what we can do at the genetic level. First ex vivo in cells in a dish, and now in vivo in patients as well. So that's really opening new areas of research for everyone.
Yes. And if we are looking forward for next 5 to 10 years, how do you see the cell and gene therapy can break to the society, and especially for the research field you are working on?
Yeah, so we've already seen FDA approvals around genetic diseases, and those are really going to continue to expand, in my opinion. We've seen some great talks over the last day or two around new therapies that are going to be FDA approved or have recently been FDA approved around rare diseases. I think those will grow. In the cancer field, where I'm a bit more focused, we are definitely going to see cell therapies expand beyond the kind of narrow niche of patients that are available can be treated with these therapies today. So we're going to see a broadening to other therapies, certainly over the next 5 or 10 years.
Yeah, that sounds very exciting. And how is your experience for the SAPA-CGT for this year?
My experience has been great. So again, I've focused on cancer immunotherapies, but seeing talks focus on gene therapies and rare diseases, for example, gives me new ideas and new technologies that we can bring to our field. So kind of this cross-pollination around these different diverse areas really brings new innovation together.
Thank you. That's all the questions for the interview, and we hope to see you next year.
Thank you. Yeah, me too.